and welcome to today's webinar on why trust matters and how to measure it in your organization. I am really excited today that we have Dr. Graham Lowe and Dr. Merv Gilbert presenting on this really timely topic today. So my name is Victoria Granger and I am with WellnessWorks Canada, your nonprofit workplace health and performance association. So what we do is we support workplace wellness, workplace health practitioners and employers in building healthy, high-performing work cultures. So we provide evidence-informed, cost-effective resources, support, and certifications focused on bridging the gap between employee well-being, culture, and workplace performance. We're actually the only association in Canada that supports and advocates for workplace health practitioners in this industry. So as an association, we offer cost-effective memberships, of course, that provide you with all of the tools and the resources and support that you need and connection that you need to succeed in your role in building healthy, high-performing work cultures, which also includes the only accreditation available in Canada that uses an online innovative platform to really assess and validate competencies and help you to learn and grow in your role. And it is self-paced, which is nice and online, but you also get weekly feedback from an assigned expert assessor. So our practitioner certification level, I actually wanted to mention because we have Graham Lowe on the call today, uses a lot of the information from his fully second edition revised version of the Creating Healthy Organizations book. And it is referenced throughout that. And with that, we are offering those who are on the webinar call today a 50% discount on the regular price of that book. So we will send out that link to you afterwards so that you can get that book. It has some just really great information and resources in there to fully understand how to support a healthy, vibrant organization. So the other thing I wanted to mention is we also have employer memberships that help connect you to an expert as well to help assess and transform your culture through an audit, a survey, tailored recommendations, strategy session planning, and an employer choice certification as well based on where you're at. And a huge perk is that all employees get access to all the tips, tools, and resources and can actually also access our individual workplace health and performance certification, which can be really valuable to have when you have a network of wellness ambassadors, to have everyone on the same page in terms of having that specific training as well. And so all of this is working towards our vision of building a healthier, higher performing Canadian population and economy, one organization at a time together. All right, so just a little bit about the housekeeping before we get started here. So our presentations from Graham and Merv today will be around 45 minutes with some time for questions and answers at the end. Please let us, write in any questions you have in the moment in the question and answer function or the chat function found at the top or the bottom of the screen, depending on your screen setup. And we will address those during the question and answer period at the end. So let's get into and introduce Graham and Merv. So these guys are great and I adore them and their expertise. So Graham Lowe has over 30 years of organizational experience across Canada and internationally. He's the president of the Graham Lowe Group, a workplace consulting firm, which you can find more at grahamlowe.ca. He also is a founding partner of the Great Place to Work Institute Canada, an affiliate of the US-based global consulting firm specializing in transforming workplace cultures. He is Professor Emeritus at the University of Alberta, and he recently published a fully revised and expanded second edition of Creating Healthy Organizations, Taking Action to Improve Employee Well-Being. Graham has given hundreds of conference talks and interactive workshops across Canada and internationally. He is a recipient of the Canadian Workplace Wellness Pioneer Award and holds a PhD in sociology from the University of Toronto. Graham's fully revised Creating Healthy Organizations book, again, I want to mention, is amazing. And so I am going to give you the link to that to get that discounted rate for it as well. And then we've got Merv. Dr. Merv Gilbert is a director at the Vancouver Psych Health and Safety Limited. You can read more at psychealthsafety.com, which is a consulting group providing services that enable organizations to foster psychologically healthy employees and workplace climates. He has worked as a psychologist for over 30 years in clinical and leadership roles and regional and provincial and international settings. And Dr. Gilbert is an adjunct professor with the Faculty of Health Sciences at the Simon Fraser University. He's also a member of the steering committee of American Psychological Association Psychologically Healthy Workplace Network, and he's a primary participant in the development, evaluation, and dissemination of resources for the workplace mental health Guarding Minds at Work, which you're probably familiar with. It's a really, really great resource. The Antidepressant Skills at Work and Psychological Health and Safety and Action Guide for Employers. So Dr. Gilbert has published in national and international professional journals and has presented at a diverse array of forums on the importance of workplace psychological health issues for individuals and organizations. He's consulted with governmental, private, and public sector organizations. So really thrilled to have both of them here. You can see more of their introductions there. So really excited to pass it over to Graham and Merv to be talking about some of these objectives on how and understanding, how trust really is a key determinant of organizational performance and employee engagement and well-being, and to talk about how we can reflect on how trust impacts psychological health and safety in your organization, and learn about this new tool, the Trust Building Survey, for efficiently measuring and improving trust.
Those very sort of embedded aspects of organizational life. And in many respects, it's really the bedrock of a functioning organization. There's an interesting analogy that the CEO of Shopify, and I'm sure you've all heard of Shopify, it's one of those great Canadian IT success stories that's been doing very well during the pandemic as people are shopping online more. The CEO and founder, Tobias Lütke, talks about how strong cultures are based on mutual trust. And he uses the term a trust battery, pointing out that when a new employee is hired and joins the organization, that trust battery is 50% charged. And it's every single interaction that employee has with his or her manager and with their coworkers that will either increase the charge or decrease it. So that's kind of an interesting way to think about it. So at this point, I'm going to pass it over to Merv, and we'd like to hear from you.
Thanks, Graham. So there's the item up on screen and so on, and we'd love to get your input. And Victoria, you can help us tabulate that.
Thanks, Merv. So the responses are starting to come in. We'll just give it a few minutes here until we have the majority, and I'll share the results. All right, we'll share the results here. We have the majority.
Interesting.
Very interesting. Yes, very interesting.
So it's going in all directions, perhaps not surprisingly. Yeah. Certainly, it's going to depend very much on organizations in which you work or organizations with whom you're working and so on. What's happened to them in the last little while, particularly with the lockdown. Some are certainly going to be struggling, so on. There may have been layoffs, or furloughs, which seems to be the new word for layoff. And there's some that may well be thriving in that sense. I'd be curious. I'm curious as to why would it go up under these circumstances. I can imagine why it might go to the same, but I'd love some comments. Graham, anything you want to add?
No, but let's hope that during the discussion we can dig into what has helped to increase the level of trust in those organizations.
Certainly, it does suggest, and that trust, as Graham pointed out, is fluid, shall we say, and fragile. So I want to talk a little bit about this survey that Graham and I, that our company, Psych Health and Safety, and Graham's group and so on, created. As Graham mentioned, we looked at, there's a lot of data out there. We looked at our data from Guarding Minds at Work over the last decade, and we looked at some of the other researchers out there, and certainly Graham in his book and both of our experience with organizations just highlighted the importance of trust. But when you talk about a construct like trust, you need to measure it. So what the trust building survey is, it's a short online employee survey that asks employees about their perceptions of their recent work responsibilities, work relationships, and management support over about the last 4 weeks. So it's intended to be kind of a pulse measure, and I'll say more about that as well. The kind of things we're asking about are related to employer-employee trust, and also directly influence engagement and well-being. The survey also includes 6 demographic questions that permit group breakdowns, and 1 open-ended question asking for suggestions to improve trust within the organization. It takes about 10 minutes to complete the 22 items, can be used over the various pulse checks, as I mentioned, and so on, to capture that dynamic change in trust that was just frankly illustrated by the previous slide and so on. It can be done within departments or particular groups or work sites, and could be customized to particular sectors. And I'll say more about that a bit later as well. I should note that all responses are confidential. This is not a measure of employee mental health or individual sense. It's taking the perspective that employees, the workers, are absolutely the best expert on what it's like to work within their setting, their company, their organization. They're the experts at that because they're the ones that are doing it. What happens with the data is stored in a secure server, it's anonymized and so on, so only group data is reported and so on. And in the base of that, we put together a report with some concrete recommendations that organizations can conduct.
Okay, so what we've got here, and thank you, Merv, for describing the tool. What we've got here is really an indication of how trust is so embedded in organizational life that it touches on many of the big issues that we spend a lot of time talking about. You know, as people who want to make organizations better and improve employee well-being, it certainly is woven into the culture. It's directly reflected in styles of leadership. It is a fundamental property of all relationships. It is also very much influenced by the extent of employee involvement in making decisions and taking actions in the workplace. And as Merv has just highlighted, it has a huge impact on employee well-being. And finally, how you go about change in your organization will either charge or deplete the charge on that trust battery that the Shopify CEO talked about. So Merv and I are going to talk briefly about each of these areas where trust is really a central issue. And I'm going to start with this slide here. Now, this is a pre-COVID picture. Let me give you a little bit of background. This picture comes from a BC company called Great Little Box Company. And a couple of weeks ago, I had the pleasure of doing a webinar for the Make It Safe conference, which is all about workplace safety, with Nick Riak, who's the VP operations for Great Little Box Company. And what we were talking about is how trust is so essential for workplace safety. And what Nick pointed out was the Great Little Box Company had gone 2 years without any lost time injuries. They have a very strong safety culture. And that culture, that safety culture, depends on people trusting managers and trusting each other. Employees trust each other to have each other's backs in terms of safety, and they trust managers to the extent that they feel that it's safe to speak up when they see something that is not safe in the workplace. They don't fear any reprisals by basically putting their hand up and saying, hey, that's not safe. We shouldn't be doing that. So what that results in, that culture is not only safety, but also a sense of community. And that's really what the picture here is trying to convey. And at the bottom of the slide, in fact, many of the slides will have this sort of red text at the bottom showing the item or the actual question from the trust building survey that gets at this issue. And the item is simple. It's basically asking people, are you able in your job to do your job in a way that fits your personal and professional ethical standards? So for these skilled tradespeople pictured here at Great Little Box Company, they are committed to safety. They're trained to work safely, and it is very much their professional and ethical standard. And the organization basically enables it 100%. And the data shows that they've been successful doing that. So now when we look at leadership in an organization is, again, a critical piece of the trust puzzle. And the term that we like to use when talking about leadership is to ask, are leaders trustworthy? Do they behave in ways, do they treat employees in ways that earn the trust of those employees? So trustworthy leaders, in terms of what are their behaviors, you can see there's 3 points here that really distinguish someone as a trustworthy leader. They listen and respond to employee input, they're open and honest about change, and they do what they say they'll do. So the item in the trust building survey that gets at this is basically a general assessment of leadership in my workplace is effective. Okay, Merv, on to you.
Thanks, Graham. Another key feature that impacts and is impacted by trust is communication. And this is particularly timely under the current circumstances. We're all being bombarded with and seeking out information from multiple sources. As we all know, Graham made reference to issues both down south, but in Canada as well. We're all tuning into the news. We're looking for alerts and so on, which can be frightening, reassuring, or often confusing. So from an organizational perspective, it's really important for leaders and workers to be in touch, but selectively, judiciously. Don't add to the noise. If you said something once, don't say it again, to quote one of my favorite talking heads lines, so on. Also, be really clear in communication. Say what you know, acknowledge what you don't know, and what you're going to do to learn more, to gather more information. I really do think that statements like, I know what you're going through, can come across as condescending and may or may not be well true, especially if employees or workers are struggling, if they have been furloughed, working from home, have childcare issues, elder care issues, or their own personal health issues. So I think a degree of humility in our communication is really important in order to be honest. And similarly, rather than global areas concerned, it's far better to provide practical information about resources, programs, tools that are relevant to the workers within an organization. That may include links to government programs, available benefits, other offerings such as EAP or community offerings, and may include opportunities for peers to help one another contribute time, effort, and money to local volunteer initiatives. And the item for that one from the survey, one of the items, there are several actually, is my organization provides clear and effective communication. Relationships, of course, are equally key and critical for job performance, collaboration, and well-being. Again, as Jim Graham mentioned, this includes trust in management, trust in colleagues or workmates, and trust in clients or customers. We're seeing in the press conflict, and perhaps not surprisingly, in various ways. When this trust is lacking, we're likely to see lower productivity, increased costs, frustration, and turnover. Interpersonal trust and mutual respect go hand in hand. That means an environment where there's acknowledgement, acceptance of individual ideas, opinions, even when they differ from our own. This also means that when there are conflicts, and there will be, that these are dealt with in a fair and transparent manner and not allowed to fester and continue. And when that trust exists, everyone benefits. As Stephen Covey mentioned in his writings, or guru of workplace consulting, the first job of a leader at work or at home is to inspire trust. It's to bring out the best in people by entrusting them with the meaningful stewardship and to create an environment in which high trust interaction inspires creativity and possibility. This is a particularly important challenge with so many people working from home or in radically altered work environments. Just as important for managers to trust their staff, managers themselves must be trustworthy, as Graham mentioned. So what does this look like? It means being reliable, doing what you say you're going to do. It means being honest, saying what you know and what you don't. It means being fair and not playing favorites. And it means humility, working towards the common good and admitting when you're wrong. And the item that reflects that in our survey is people at work show sincere respect for others' ideas, values, and beliefs. On to you, Graham.
Okay, thanks, Merv. So involvement, giving employees the opportunity to have input, to have a say, to be involved in decision-making, to participate in change, especially during this unprecedented time of the pandemic, All of these actions within an organization are going to build trust. Now, I want to give a simple example of how, on one hand, many organizations give their employees an opportunity to have input when they conduct an employee survey, which is really opening up the door for trust building. Yet, when those survey results come in, very little, or in some cases, absolutely no action is taken. And what that does, as many of us have seen, is it actually ends up reducing trust. And the most obvious impact is the next time you go to do a survey in the organization, the response rate is considerably lower. So this shows you how having input is critical, but as Merv has emphasized, it's the follow through. And it's really providing meaningful input. By meaningful, that means that senior management listens and responds. It doesn't mean you have to do everything that employees have suggested in a survey or in some other form of employee consultation mechanism, but you at least need to acknowledge that. The other thing that gives employees a sense of trusting the organization and their managers is when they have opportunities to actually use and further develop their skills and to apply them to achieving the mission of the organization, which gives them that sense of fulfillment that they're contributing to something that's larger than themselves. This is also really critical in terms of building trust. The survey Merv and I conducted for the school board in Ontario was interesting because it gave employees, it showed how eager they were to have input. And it actually asked them many questions about what their preferred work arrangements would be as the school board moved into that sort of post-pandemic recovery phase. And basically management acknowledged this. So the fact that the survey was conducted in the first place and that there was an acknowledgement of what the needs of employees were, which turned out to be very diverse. I mean, it wasn't a one size fits all in terms of working from home or not working from home. And the fact that management acknowledged that, I think, is really setting the stage for even higher levels of trust in that organization. So in the survey we've developed, the trust building survey, the item that we have, and there's a couple of them, but the one that really stands out is simple. It's my opinions and suggestions are considered at work. In other words, what you have to say is listened to. Over to you, Merv.
Thanks, Ram. Well-being. We know that trust is important for physical and psychological well-being. I think this is a worth pointing out because we tend to forget this often when we're talking about stressful work and toxic workplace and so on. It's really good to remember that good work is good for our physical and psychological wellness. I'm going to quote Freud because psychologists are obliged to do so. He said some weird things, but one thing he did say, which I think was quite wise, was that no other technique for the conduct of life attaches the individual so firmly to reality as laying the emphasis on work. For his work at least gives him or her a secure place in a portion of reality in the human community. He also said the two most important things in life are love and work. So remembering that good work is good for us. It provides a sense of structure, social meaning, opportunity for social interaction, identity, and an income. And all of those things are good for our physical and psychological health. But as we increasingly recognize, an unhealthy, toxic, whatever language you want to use, work environment can lead to distress, disorder, and potentially disease. And with the pandemic and pandemic response, these outcomes are certainly being further exacerbated. I read a study out of the US recently and so on. It was a longitudinal survey and found that 14% of the people that they sampled were reporting serious psychological distress as opposed to 4% 2 years ago. And they attribute this to worries about getting sick or the impact of COVID on employment, education, finances, health insurance, it is the US, or access to child care or elder care. And that applies to us as well. So it's really even more important for organizations to create workplaces that support worker well-being rather than contribute to that distress. You may be familiar with the National Standard of Canada for Psychological Health and Safety in the Workplace, which was based on a variety of different things, including some of the work we've done previously. And this is basically a framework requiring employers to monitor, address risks and hazards, adhere to effective safety, psychological and physical safety policies and practices, and provide training and resources to support physical and psychological health. I'd add to that also to measure the results, and we'll say more about that in a while. And again, in the survey, we're checking that out by asking, my employer is committed to minimizing unnecessary stress at work. Okay. Well, times they are a-changing for sure. And so change is another key factor, whether it's change that comes from external factors, as we're currently seeing, or internal factors, as we're also currently seeing in the current circumstances. I think a really important construct that helps us look at trust during change, this notion of a psychological contract. It's a useful reflection of the nature of trust under circumstances of change. In general, the psychological contract may be understood as an understanding of the terms and the conditions of the exchange agreement between an employer and an employee. It's an understanding, it's a belief that some form of promise has been made and that all involved accept the terms for that work relationship. It's unwritten. It's not the job description. It's not the work contract. It's not the union agreement. It's a mutual understanding of what employers and employees expect of one another. By its very nature, it's constantly changing, is highly flexible, and often undefined or even unspoken. So they rely on interpretation, both by the employer or manager and the employee. It's a very significant determinant of behavior in organizations, and perceptions of violation of that contract have lasting effect. Some may perceive a violation of the contract, while others are certainly fine with theirs. It's about perceptual person experiences and so on. And if that contract is broken, the other party may not know it's broken. An example might be people willing to put their shoulder to the wheel and work some extra hours if someone doesn't show up. But if there isn't that recognition, or that's asked too much and there isn't some kind of reciprocity, people are going to work to rule, as it were. Or employers will impose implicit kind of glass ceilings on advancement or other opportunities. So really trying to pay attention to that relationship and make the implicit explicit as possible is really important during times of change, so on. So everything you can do during this COVID reaction and beyond will build or erode trust. And the item that we've got in our survey that reflects that sense of change is, I am informed about important changes at work in a timely manner. Graham.
Okay, so one of the themes that's obviously come out in our discussion so far is the importance of accountability. And that means that certainly managers need to be accountable for making the changes, for following through on the commitments that they've made. There definitely needs to be clear and open communication about any plans in the organization, and transparency about how and why decisions are made. If there's something wrong, let's say you identify that through an employee survey that employee ratings of constructive feedback is quite low. Well, so what are the actions that you're going to take? And also involving those employees in trying to figure out what actions would really be most effective and meaningful for them would be one way to demonstrate accountability. I like to think of accountability as really a process of continuous improvement, and the conversations that are so vital to really fuel that process of continuous improvement. People are basically always talking about how can we do things better? How can we make this a better place to work? And the example of not following up on employee surveys is one way to really short circuit this entire process. For employees, certainly they have their own sense of accountability, and they part of their psychological contract, as Merv has emphasized, is what their expectations are of management and how management is going to treat them, but also, and in some cases equally important, how they're going to be treated by their coworkers. So obviously being treated respectfully in a civil and fair way is really important. But it comes down to little things. I remember a series of workshops I did for a large municipality in Ontario, some years ago talking about their values, and one of the values was accountability. And I remember the road crews coming in. So these are, you know, the city employees, blue collar workers out there filling the potholes. And they were asked, what does accountability mean to you? Because it was one of the values. And they said, when my team members put their tools back in the right place. So that's a sense of, you know, it's a small thing, but it really is what's going to lead. Like if everybody follows through in that from the perspective of this team, that's what's going to lead to that reciprocity, that real sense of I can trust my fellow team members. So looking at the trust building survey, the one item kind of moving more up to the organizational level that is measuring this sense of accountability is that difficult situations at work are addressed effectively. So now we're over to you. We've got another poll that we'd like to run. Basically, the question is, has your employer assessed the impact of COVID-19 on employees or your psychological health? And we're very interested to see what the results are on this. So I think we've got about 60 seconds to click one of those buttons, and then we'll get our results.
"20 seconds left."
Thanks, Victoria.
Interesting.
Okay.
Interesting. Love to hear more about that. And let me make one comment, if I may. Notice the question, the survey question, which is around psychological health. And one of my pet peeves or pet concerns, I guess, is psychological health and mental health are not necessarily synonymous. Mental health often refers to disease, diagnoses, and the like, and so on. Psychological health is that broader continuum of psychological distress through to psychological well-being, thriving, that whole continuum, and so on. So I'm going to be curious about what kind of measures people are using. Let's switch now. Let's talk about psychologically healthy workplaces. So Graham and I are stressing that there's a reciprocal relationship between a workplace that's trustworthy and one that's psychologically healthy. So what does a psychologically healthy and safe workplace look like? Frankly, I think all of us know when our work or we go into workplaces that are psychologically healthy and those that aren't. You can almost smell it. You can almost feel it in the air. It's when people find work fulfilling because it's consistent with values, allows them to use their skills, us to use our skills and abilities, and provides an opportunity who we like, respect, and trust. When we're willing to put in that extra bit of discretionary effort and time when needed, because we know it'll be appreciated, acknowledged, and won't expect it unreasonably. Are we there for us if we know we need it or our family needs it? It's a culture where people work together guided by common values. And requires, as Graham mentioned above, strong sense of integrity and shared responsibility. So we're all engaged in positive working relationships and communication. So that's kind of what it looks like. There's a number of models out there of psychologically healthy workplaces. This happens to be one from Australia, the Australian Psychological Society, and so on. I think it's a reasonable model, very definitely. Psychologically healthy workplace integrates goals of health and well-being, as well as organization goals of performance and productivity. They do more than just improve productivity. They build a vibrant culture that supports the company, the employees, and the community of clients and customers that it serves. It's good for staff and good for business. And I think that's a key thing. I think with the organizations that we've worked with, if there's a sense that it's up to the employer to provide all these things, and there's finger pointing, or it's up to employees and so on. It does need to be a cooperative effort in many ways. There's no one size fits all to creating psychologically healthy workplaces. It's based on a challenge unique to that particular organization or sector, and tailoring programs and policies to meet those needs. We were involved in a study a number of years ago following a bunch of organizations as they implemented the national standard, and good companies, good efforts. But what we did find was a lot of organizations that came down to doing something really were at sea in some ways and finding something that really fitted their culture and their needs. And there was a tendency to sort of grab programs, if you will, off the shelf rather than looking at whether they necessarily fit. I was involved, I have continued to be involved through the American Psychological Association with a initiative around recognizing psychologically healthy workplaces. And I want to cite an example from that from some years ago. There was an extended care unit. There is an extended care unit in interior BC, actually, I think close to Kelowna, called Brookhaven Extended Care. And as I'm sure you may be aware, an ongoing challenge in the healthcare sector, and certainly a challenge that exists today, is access to staffing. So this organization, like a lot of healthcare organizations, relied on primarily nursing in this context, providing overtime or coming in on days off. And that was a real challenge when there were school holidays or school breaks, because a lot of staff, not surprisingly, were women who had childcare responsibilities and so on, and couldn't work that overtime. So those would often be their staff shortages. But one of the staff members suggested, and I think she was a recreational therapist, I recall, is why don't we start up a program? As I mentioned, the organization is called Brookhaven. So they set up a program called Little Brooks. And what that meant was that staff members could bring on those days their kids, say between ages 8 and 12, into work. Now, this was not a daycare or childcare program. The kids were paired up with one of the clients within the organization, who were, in some cases, many cases, the elderly, but also brain injured adults and so on. So Nancy will say, who's a single mom, brings her kid Johnny in, and he's paired up with Fred. And Fred's a, I don't know, Korean War veteran who maybe lost a leg, and he regales the kid with all sorts of stories and so on. The kid's delighted. The child gets to see what his mom does for a living. She sees that her child is engaged. They have lunch together with Fred. It really is, and forgive the cliche, win, win, win. The cost was nothing. Good example of leadership in this one, because there was some pushback from the lawyers saying, what if Johnny falls down and twists his ankle or something? And the leader said, no, don't worry about it, we're doing it. It was a raging success. Staff lined up to work on those days when they could bring their kids, and the program was expanded to other settings. That was some years ago, and didn't have much of an update, but I did manage to talk to them a couple of years ago. And what had happened was that some of the kids who were involved in this program and so on aged out, say it went up to age 12. So on their own, a bunch of teenagers that had been involved and so on formed their own program and continued to provide volunteers. To my mind, that is one of the best examples of an organization creating a psychologically healthy workplace. It came from staff, it had leadership support, and addressed a real and measurable issue. Next slide, please. So I'm not going to go in detail in this one, and you may be familiar with the fact that in the standard and Guarding Minds, a number of different tools and resources out there. There's reference to the psychosocial factors that are potential risk factors to either lead to psychological distress or to psychological well-being and so on. They're based on, as I said, all our research and work that we've done through the years. But there's a couple things I want to point out. While they're relevant to most organizations in the sector, does that mean that this does not mean they're the only factors? Indeed, we recently did some work with the healthcare sector and the paramedic sector and identified new factors unique to those groups. For example, for healthcare, we identified a factor, and it's included in a specific healthcare survey, called protection from moral distress. In other words, a healthcare work environment where staff are able to do their work with a sense of integrity, supported by the profession, their employer, and their peers. I also want to note that these factors are by no means orthogonal. In other words, they're not statistically independent. They overlap and are interrelated. If a change occurs within one factor, either positively or negatively, it's likely to influence the other factors. And finally, I do want to note that the trust building survey includes items that measure many, but not all researching factors. This supports that having a trustworthy organization is an integral component of a psychologically healthy work environment. Next slide, please, Graham.
Okay, so to build on the 13 factors that Merv has just briefly described, we want to highlight 6 of them as having really very major influences on trust during the pandemic. And we think that this will continue during the post-pandemic recovery that organizations, at least we hope organizations, are now thinking about and planning for. The first emphasized is psychological support, which basically refers to a work environment where coworkers and supervisors are supportive of psychological and mental health concerns and actively respond as needed. Merv just gave a great example of the second influence, which is balance, which means recognizing the need for balance between work demands, family and personal life, which, as I think we've all come to understand, is a huge challenge, especially for people who are having to work at home during the pandemic. We've had many reports and even some empirical evidence from surveys showing that people are putting in longer hours of working from home. The work-life line is blurred, if not totally eliminated. Many women have left the workforce in Canada because of the fact that they've had school-age kids during the spring to look after and trying to do a job, which of course is almost impossible. So the balance issue really is absolutely central now and going forward. The third influence is culture. And we've given lots of examples of culture, the values in organizations, how they come into play. And essentially, there are organizations that have highlighted trust as one of their core values. And I refer back to the example I gave you as the Great Little Box Company. I mean, they talk about trust. They're very, very mindful of the importance of trust for a safe and a healthy workplace. And honesty and fairness. I mean, these are basic values that need to become embedded. And of course, the values will vary depending on the organization. Don't try to reinvent new ones, but rather try to breathe life into existing values that can provide beacons for you during this time of unprecedented change and provide really the guideposts that can help people work together to support each other and to build a healthier and a safer work environment. Fundamental in that regard are the two next points: civility and respect. Basically, respectful relationships are a prerequisite for a psychologically healthy and safe and productive workplace. And this extends not only to coworkers and their supervisors and managers, but to customers, clients, the community. And you know, this is in all of the work that we've done pre-COVID, dealing with harassment and bullying in workplaces and toxic work environments. I mean, really, it all comes down to cultivating that ingrained respect and civility in all working relationships. A fifth factor is protection of physical safety. And I think my Great Little Box Company example of a safety culture really highlights how that can happen. And there are many organizations in this country that really pride themselves in having a very robust safety culture. But interesting, because I'm doing a lot of work now with the manufacturing sector, and occupational health and safety professionals who, 5 years ago would have just been focused on preventing physical injury, are now getting the importance of embracing and expanding their purview to include psychological safety. So I think that's a major step forward. And certainly the national standard in Canada has been one of the resources that has really helped them kind of move down that path. And finally, as a big influence, and again, this is repeating one of the prominent themes in our discussion so far, the importance of leadership and clear leadership and clear expectations about what's expected of employees, so that people know what they need to do, and they also know how their work contributes to the mission and goals of the organization, and they get feedback on making those contributions. So these are really, for us, the key features of a healthy, safe, high trust, high performing work environment now and into the future.
So, thanks so much, Graham. And just to add on to the last slide, those are some of the factors that we think are going to be impacted during the current COVID situation and so on. But frankly, it's an empirical question. And I think which factors will vary from company to company and from sector to sector. Briefly to recap what we've been saying all along and so on, is that a psychologically healthy and safe workplace culture is critical for organizational productivity and employee engagement. The trust is a key ingredient in creating and maintaining such culture, particularly during the COVID pandemic. And the key features of a trustworthy organization can be measured and addressed. So next slide, and hopefully we got some questions and comments. Back to you, Victoria.
Thank you so much, Merv and Graham. That was really great. Lots of really great takeaways, for sure. I particularly liked what you were saying about making implicit statements, implicit conditions explicit. I thought that was kind of neat. Anyway, so I have a few questions here. So one is from John. He says, do you consider involvement or opportunities to provide input as an aspect of perceived organizational support?
I'll jump in, and Graham, you too. Absolutely, definitely. Again, one of the factors there is involvement and influence. And I think the example we've cited of this, well, several of them actually, but the school district in Ontario was a beautiful example of soliciting and listening to the input and involvement from employees. So definitely, yes. Graham?
Yeah, I think this is critical, John. I think that involvement can take many forms. I've heard many examples of virtual teams, during the pandemic. I mean, they're starting out each meeting by just asking a simple question: how's everybody doing? And basically people, very sort of briefly kind of recapping how things are going for them, and what others on the team can do to help them and support them. And so that generates that sense not only of involvement, but also of support through that involvement process, as brief and as simple as it is. So really, it's very vital.
Great, thank you. So I have another question from Kylie here. As a former nursing student, I saw firsthand a decline in well-being among healthcare workers. What do you think is the biggest issue in the healthcare system today with regard to the big influences?
That's, again, if I may, I'll jump in on that one. I made reference earlier on to the survey we developed specifically for the healthcare sector. And as I said, one thing that comes out of the literature, came out of our interviews and discussions, was a sense of moral distress and so on. And we're certainly seeing that along. We're seeing fatigue, a sort of burnout, if you will, use that language and so on. But the sense of moral distress, we've probably seen the newscasts of healthcare workers at all levels in tears, having to make exceptionally difficult decisions with respect to providing the care that they've been trained to do, that their values and ethics tell them to do. So I think there are many, certainly workload and so on, but the one that I think is we're paying a lot more attention to in a lot of different areas, and applies to essential workers as well, is that sense of moral protection, a just workplace.
So I'll go back, Carly, to the many decades of research on work stress, going really right back to the 1970s, that demonstrates very clearly that when people are faced with overwhelming workloads and lack control over those work demands, stress levels go way up, and that affects their psychological and their physical health. And unfortunately, in healthcare, and in particular in extended care facilities, we are seeing this in ways that prior to the pandemic were really unimaginable.
Yeah. Thank you both for that. So I have another question here from Anne-Marie, who is doing some work at a medium security institution. She says, stress is high. The main topic they want to address is no blame. What advice would you have with creating a trustworthy organization in this setting?
Well, I've got a couple comments, but then I'll hand it over to Graham. So, and we actually, about 6 months ago, maybe a year ago, did some work with a forensic psychiatric setting in British Columbia and so on. I helped them implement and then interpret and act on their guarding minds at work results and so on. Certainly, in that sense, what came out was a lot of blame and finger pointing in varying directions. So no blame sounds good, but in real terms, I'm not quite sure what that means or how to measure it. I'll hand it over to Graham for some comments.
So Anne-Marie, this idea of a no blame work environment is absolutely central to creating what in other industries is called a safety culture, where people feel free to speak up immediately when they see something that is unsafe. And there's a lot of research and a lot of practical advice on how to create that kind of no blame culture. Really, it comes down to, first and foremost, leaders demonstrating that they are really open and encouraging of people speaking out. And second, that when people do speak out, there's obvious listening and there's some follow-up action. So that's really critical. Now, there's also the concern when it comes to safety, writ large, that your coworkers can also be a source of blame if basically you're rocking the boat if you say something that really reflects on unsafe conditions. So it's really important that there be role modeling from senior management, frontline supervisors, basically right down the chain through management, so that frontline workers, understand and can basically do the same and support each other to not blame when they see something going wrong. I might add that there's a new safety culture online course. It's 90 minutes that I had a direct hand in developing for the Manufacturers Safety Alliance of British Columbia. Just go to their website, you can see it. I think they charge $49 for the course, but it might be useful. It's geared to manufacturing settings, but it covers all of these issues in terms of creating a no blame culture.
Perfect, thanks. We can share that afterwards. So I have another question here. Might be the last one, just looking at time. So any suggestion to bring union partners along in a highly unionized environment with multiple bargaining units? That one can be tricky.
I mean, yes, critical. Certainly, again, in our experience, and I think we made the point of respect to involvement and influence. In a unionized environment, or union participation is absolutely critical. And certainly in all the work we've done, most successful workplaces, organizations are creating a safe, psychologically and physically safe culture have taken a joint effort by union management, and by employees in terms of participating in programs and so on. So in a multi-union environment, I'll make reference to our trust survey as well as other tools. They do permit measurement within a particular bargaining unit or set of workers as well. And I think some of those differences can be rather critical. I won't use names in this one, but we did work with the university a number of years ago, and they broke it between admin staff, teaching staff, so on, professors. And there was a very different perception of the work environment from those points of view. So bringing in those unique points of view are certainly critical. In terms of getting their participation, I think the most simple response is just the recognition of the importance of these issues and the fact that the unions, the union reps, perhaps the occupational health and safety reps and so on, do have an active role to play and to participate in. Graham?
Sure. So I did a day-long workshop some years ago on the national standard. at an industrial relations conference, and most of the people in attendance at this workshop were union leaders. And it was pretty clear that they would welcome an opportunity to learn more about a psychologically healthy and safe workplace. The concept was new to many of them. And that, to me, signaled the importance of really open and often back-channel communication between wellness professionals in a workplace, occupational health and safety professionals, and union leaders, so that that if this is a new area for your organization, that everybody essentially can get on the same page and understand their different yet very important contributions given their roles in the organization. And as far as the national standard is concerned, it does have, and the guidebook for the national standard does have a checklist for not only senior leaders in an organization, which means senior management, but also for union leaders. So it's really giving those folks an opportunity to really get their heads around what's involved, what role they can play, and how that role certainly needs to protect the interests of their members, but at the same time can be very complementary of what senior management is doing. But the key, open communication.
Perfect. Thank you. Thank you so much both for answering those questions and giving us some really great tips and tools and practices that we can incorporate into our workplaces to really build a foundation of trust and psychological safety. So I put in the chat function here some links to both Graham Lowe's website here has a link to the trust building survey, so you can have some more information about pursuing that, as well as healthsafety.com's website, and then also the link to Graham Lowe's completely renewed and revised Creating Healthy Organizations book with the code to use that. But we will follow up by email as well afterwards. And so welcome any further questions or comments after this if you have any. And otherwise, I'd like to thank everybody for attending here today, especially thank Graham Lowe and Merv Gilbert for sharing their expertise and their time to bring all of this great information to you. We do have another webinar coming up on January 6th around mental health for leaders. So we'll send a link to that as well if you're interested in that. And otherwise, I just see one quick question about where do I find the chat box information. It should just be above that post that you did there, any of that. But we'll send it out by email as well so that you have all the information. So thank you very much. Graham or Merv, did you have any closing comments?
Well, thank you, Victoria, for hosting this, for being the moderator, and also thanks to all the participants. Great questions. And we would welcome any sort of ongoing discussions with any of you on these topics.
And ditto. Thank you all.
Yeah.
Perfect. Thank you so much. Everyone have a great rest of your day and week.